that there are so many people here today, as I can't see you all on my screen at the moment. And on behalf of the CTA, I'd like to begin by welcoming you all here today to this, our virtual space and our virtual conference. It's a fantastic thing that we've got 200 delegates registered to attend today across the UK, but with a big spotlight on the work going on in England. And I'm so excited about the lineup we've got for you today. But before I talk more about the day ahead and some of the brilliant work going on within CTA, I'd like to take this opportunity to say a huge thank you to our England team. Caroline Whitney, our Director for England, who you'll hear from in just a moment, and her team have worked so hard to bring you this event today. And given it's the only chance I'm going to get to speak to the room in its entirety, I just wanted to acknowledge that at the start, because it takes just as much planning for a virtual conference this size as it does for an in-person one. So apart from the catering, of course. So thank you very much for all of your efforts, Team England. So the conference today is all about inclusive transport and the role of community-led solutions. And that, in a nutshell, is pretty much what the CTA and its members are all about. CTA is an organisation which puts our members first, and we prioritise inclusion and accessibility, and of course, champion the volunteer service. And it's our members and the stories of our members who are at the heart of what we do. And it's the CTA's job to amplify that voice when it comes to policy and work in partnership with other stakeholders to ensure our members' voices are heard. So we need to provide the network and the structures so that we can continue to be innovative in all that we deliver, just like our members. And when I came into post in September last year, I spent a lot of time with staff and members and our board to work with them to explore how we can do all that we do, but do it even better. And one of the main themes that arose from that piece of work is that community transport is more than just a sector. It is at its heart, and it should be known as really, as a movement, the community transport movement. It's a vibrant movement. It's built on partnership. It's based on peer support, networks, and there's this big focus on inclusivity and equity. And that's what we're working on here at CTA over the coming months and the year. There are things that we're going to be undertaking, so we want to make sure that our membership offer is absolutely what our members need it to be. So we're doing a full review over the coming months. We're developing our training offer this year, and later this afternoon, you'll hear more about the Midas transformation if you're going to be in that workshop. There's already some preparation work going on in the background and the beginnings of a manifesto, as we will inevitably move towards a general election in the next 18 months. And we're also exploring how we can provide and improve our advice and support to our members. That's a real cornerstone of what we do. And as part of this, we're relaunching the old ADIs in a new format as community building sessions. And the first one for that is going to be this Friday. So it's all incredibly busy, but it's all incredibly exciting as well. And CTA are here to lead the sector and to be the best that it can be. And it won't all happen this year, but we're building the strong foundations for this year and the years to come. And there's lots of things that will happen this year. So we've got CT Week coming up later on in the year, which will give all of our members across the UK an opportunity to get involved and showcase the work they're doing within the communities. And also we'll be bringing back our national conference and community transport awards as well later this year. So do look out for that. But back to today, we've got a brilliant programme of speakers and workshops for you. And this morning, there's going to be a big focus on the tackling loneliness through community transport. I'm going to hear lots of perspectives on this. So we'll hear it from a policy point of view, as we hear from the DFT. We'll hear from the CTA staff who've been involved in the project. And of course, some of our members who've also been involved. We've got a policy update for you on the Bus Services Operators Grant Fund. And there's also going to be an opportunity to ask questions there. And also before lunch, you'll hear about the NHS Volunteer Responder Programme and how a volunteer car service can connect people to health. After lunch, we've got Richard Holden MP, the Minister for Roads and Local Transport, who's going to be talking about the importance of community transport in the transport system. Now, I know many of you here today, and certainly CTA, know how important it is, but we need this message, to go out to the wider transport sector. And again, there's an opportunity for your questions there. And then later on in the afternoon, it gets a little bit more interactive as you split off into your workshop groups. You probably know that when you joined today, we're recording the speaker sessions. We're not recording the workshops, but we will be doing a series of written updates from the workshops following the sessions. So do look out for that as well. So I'm now going to hand you over to our Director for England, Caroline Whitney, who's going to spend a little bit of time introducing the Connecting programme and some of our priorities for England. And we're also going to run a little trial with the question and answer box that we're going to use, so we can use it for the rest of the day. So over to you, Caroline.
Morning, everybody. I'm just going to pull up my presentation for this morning. So it's really exciting to be joining everybody this morning. This is the first England Directorate conference that we've had, I think, at CTA for a long time. So, you know, it is really nice to have so many people here this morning, and we know that more will be joining this afternoon. When we kind of started talking with CTA members and wider stakeholders kind of last year, one of the big things that came out was how can we work more collaboratively and collectively around ensuring that CT can be sustainable and that we can build and enhance on what we've already got. So we did start to run a connecting programme, is what we've been calling it. So it's connecting CT with our CT. I'm just going to talk through a little bit of kind of what we know about the sector so far and a little bit of where the connecting programme is up to. I apologise, some of you might have seen some of this fairly recently, but there should be a little bit in here for everybody. The map that's just on the screen is how we have kind of split up England a little bit in terms of our regional work. So we've split England into 11 regions. Part of those follow what are the subnational transport body footprints, so particularly in the south of England, and then in the Midlands and the north, we're kind of following the region areas a little bit. So this is the split. So the first kind of bit is, what do we know at the moment, a kind of little bit about community transport. Research and data is really important. In June, we have a new research and insight manager starting, and we are going to be launching an 18-month programme to really try and understand, particularly in England, but kind of learning across all nations, what is the state of the sector, what are people delivering, and what are the key issues, and doing a few deep dives. But just some kind of recent data from our members. I've put there kind of that CT is transport for everyone. And I think one of the things that I've come across in a number of conversations is that Section 19, oh, it's membership, oh, it's restrictive. They only support small groups of people within the community. Now, we all know that's not the case, and we want to have evidence to showcase that. And one of the things our members have told us, so 53% of the sector is currently operating with a very broad membership. So effectively anyone in the community that has a barrier to transport, they have no age or no mobility requirements. So it truly is a service for everybody. Most people use Section 19 permits to operate their service. And then in rural areas, it's a higher proportion of Section 22 permits. So we have a kind of bit of a mixed model between rural and urban in terms of our delivery. Interestingly, so in terms of the turnover, we classify community transport providers in two separate ways. One is what we call primary purpose and one is secondary. So unsurprisingly, primary purpose CT operators are those that purely exist or mainly exist to provide transport, as opposed to a secondary provider who might have a different main objective. So it could be you exist to support people with disabilities and transport is a secondary part of what you do. But generally, in terms of those providing community transport, 52% of them are primary purpose. And generally, most organisations are fairly small. So overall, we've kind of got, just over 40% that are under 100,000. But when we break that down to primary purpose, we've got nearly 57% that have a turnover of 100,000. Interestingly, when we compare this to national data, in terms of charity data, actually about 80% of the sector nationally is under 100,000. So we're slightly bigger than the average voluntary sector organisation nationally. Volunteering is a significant issue, and there's a mix of kind of the number of volunteers that are involved in organisations. from organisations having 30 or more volunteers to a small number not having any volunteers at all supporting their system. But actually most organisations, so 80% of our members do have volunteer drivers. So it showcases how really crucial volunteers are in terms of the delivery of services. Most of the sector has quite a small number of vehicles. 60% have 1 to 5 vehicles in their fleet, but most own their vehicles. We are starting to move down our EV, and we have got a workshop this afternoon. So hopefully if you're thinking about getting into EV, you'll attend that session. It's about 9–10% of people currently have an EV vehicle within their fleet. But there's so much more we need to know. This is just touching the surface in terms of some of the information we need to know about community transport in England. So as I mentioned before, we are going to be doing a kind of bigger research project. We will be setting up a stakeholder group to try and make sure the data that we collect is useful and meaningful for as many people as possible. So our connecting programme overall, the aim of the connecting programme, so we say we have forums, but it's so much more than a kind of networking forum. It's a research and policy programme effectively for CTA, but we want to work on that research and policy at a regional level and a national level. And we need to do things collaboratively. CTA is a small team. We need to work with you as community transport operators and with you as a wider stakeholder group in order to see change happen. So, and we wanted the kind of structure effectively to provide a voice and to provide action at a local level, right up to a national group, including our colleagues within government as well. So the local forums are ones that are generally managed and facilitated by local CT organisations or local voluntary sector or even local authorities, and they're great and they're so vital in terms of delivering things locally. We're looking at facilitating regional and England forums. We've had the first round of all of those and we're just about to release new dates. And then we're working with our colleagues in the Department for Transport to set up a national stakeholder forum that we will be able to feed into. But while there are meetings and while there are forums, at the heart of it, it is a research and policy programme. So because it is a research and policy programme, there are a number of things that have come out of the last round. So on the left in the white, we've got a list of some of the actions that we are looking to address at a regional level. So each of these topics that are listed on there will be picked up by a different regional forum, depending on what came out of the recent discussions. I haven't listed which regions on here because we need to go back to the regions just to confirm them, but this is the kind of list of things we're looking at. And then we have a number of priorities which are national priorities that we would want to work on as a broader group. So these are issues that generally are impacting at least 3 or more of our regions. We did have an England forum a few weeks ago where we kind of started to talk about kind of just prioritising them in terms of, we can't do everything. That's a massive list. We can't do everything tomorrow. What are the things we need to start tomorrow? And what are the things that maybe we could start next week, next month type bit. So the national priorities, there was kind of 4 that were prioritised at the last meeting, which were national funding for the sector. You know, we can work regionally with local funders, but we need to do something in terms of on a broader picture, in terms of funding for just general running costs, maintenance costs, as well as new vehicle costs. Volunteer recruitment and retention is a kind of big issue. Wide-scale promotion of community transport to the public and stakeholders, and then legislation and regulations. So, for example, D1, permits, blue badges are some of the issues we're working on at the moment, and you'll hear a little bit in terms of later on this morning about the BSOG update. Just to say, I haven't looked at the chats or any questions, but if we get any questions about D1 today, we are still waiting for the summary report from DFT on D1, so there's not any movement on that yet, but as soon as there is, and we are in regular contact with Department for Transport on this issue, as soon as we have more, we will share that. Just on the kind of wide-scale promotion of CT to public and stakeholders, and I'm dropping this, I haven't let the team know, but we are planning a national CT week, and at the moment we are looking at that is going to be in early October. So this is going to be a wide scale across the UK. So this is a CTA UK, it's not an England programme, it's a CTA UK programme, in terms of really going out there and trying to promote and share the great work that CT provides. And our team will be in contact with members and stakeholders over the coming months to make sure that everyone's geared up to be able to kind of share as much as we can during that week in early October. So that's a little bit of an overview of kind of some of the work, some of the priorities that are happening at the moment. If you want to engage with any of this work, there's a couple of ways that you can do that. The main one is kind of being part of our mailing list. So I've just shared the screen. So our website there is a bit where you can sign up to our mailing list. Please make sure if you're on today and you're not on our mailing list that you sign up for that, so that we can keep you up to date with everything that's going on. And then the ways to kind of be involved is you can kind of be part of some of the forums. You don't have to attend every meeting. You can just kind of share your views, or just kind of make sure whenever we put research or any policy requests out there that you feed into those. We want to try and create other methods for the sector to engage with us, but at the moment, please just make sure you are connected into our mailing list. I have just shared the slide there. This is only the England team, so it's not the whole team at CTA. We are a much bigger team, but just for any England colleagues on today, we have 3 development officers that support our team, kind of Chanel, Paola and Sean. You will get to meet everybody today. We've tried to make sure that all the team have a role in today's event. But if you are based in the Northeast, Yorkshire and the Humber or Midlands, then Chanel is your main contact. If you're in the Northwest, Southwest Peninsula, which is the very kind of end of the Southwest, or London, then Sean is your contact. And if you're in the East, South Central, which is a bit of a different area, and Southwest in the Southwest Gateway, so kind of Bristol area, then Paola is your contact. If you aren't quite sure, then please let us know. We've got a little tool that we can share which area you're at, and please kind of contact us and speak to us. So that's a bit of an overview. Now, today's session, we have tried to build in at each of the speakers a bit of a chance for question and answer. And we've got quite limited time today, so we want to try and make sure that if we are answering any questions, they're the questions that matter to you as an audience. So we're going to give it a little bit of a trial before we get any proper speakers lined up for the day. So you will notice on your screen, there is something called chat and something called Q&A. And what we're talking about is the Q&A. So we're going to try and give it a little bit of a go. We've got a few minutes before we'll kind of bring in our next speaker. But what we want you to do is, if you've got a question on anything that I or Victoria have said, or if you've just got a random question that you want to ask, like, what is your favourite potato? That's generally a question that our team ask each other quite regularly. Any sort of question that you've got, put it in the Q&A box. And then if you like that person's question, give it an upvote, because then what happens is that question appears much higher, and they're the ones when we get to the speakers that we will be asking. The other bit to say is that we do have technical support. So if you have any issues today where your sound drops out or anything at all, please do message directly the staff that are providing the support, and their names start with support. So it should be fairly straightforward who they are. I'm going to stop sharing my screen now, just so I can see you all a little bit better on my computer. It's lovely that so many people have got their cameras on, I have to say. So lovely. So Nigel has asked a great question, and 9 people have upvoted it, and it's a question that I don't necessarily have an answer to at this point in time. But so Nigel's question was, how can CTA help to get funding for our sector? And there's a couple of ways that we're planning to at the moment. The first is around data and evidence. So there's lots of perceptions about community transport, and we want to try and make sure we have a clear picture of community transport, that we can go out to national funders to share the kind of issues and challenges and try and make that case for funding. We have been having conversations about how we can work with national funders to encourage them to ask people their funding. Well, how are you enabling your clients to get to services? So I think one of the things that happens, and we'll explore it a little bit in the workshop, one of the workshops this afternoon, is that voluntary sector and local authority design a service and then worry about how people get there at the end. So how can we encourage national funders to actually build in transport into those bids? So there's a couple parts, and obviously we're consistently pushing things with Department for Transport as well. Then the next question on there that's been upvoted is, can CTA create a mentoring scheme for new CT projects? It's one of the things that we have been talking about internally, is how can we have peer support, so larger CT providers supporting smaller ones, and we're looking at building a kind of intro to CT training program for new people that are coming in. And we also had a conversation a little while back with the CVS and infrastructure network around how we can support them to have the skills to support CT as well. And then the other thing, I will give it a plug because it is happening. So from a CTA perspective, we are reviewing our membership offer. So members in the next kind of month or so will start to get a little bit of a survey about the membership offer directly, so what we actually provide to you. So those. Then change that to most upvotes. So one of the questions that's upvoted from Lisa in Hampshire County Council: how can local authorities work better with CTA to promote the importance of CT to central government? Is it through the development officers? So one thing, I think we definitely need to take that question into the workshop this afternoon, and we can explore that a little bit more. My initial kind of feeling would be, it's a range of ways. So the regional forums is one good way for local authorities to kind of work with us, because we will be flagging things through the regional forum up to the national forum, which DFT will be engaged with. And I think there's also about thinking about what routes local authorities already have into central government, and how can you pull us in to that. But development officers are a really good start and a really good connect in. So that's the last of the questions, just because I'm keeping my eye on time for today. What we will do is we are going to kind of do some feedback after the event. So we've got all of your questions, and we'll try and make sure that anything that isn't covered during the rest of the day, we can try and give some broader feedback to everybody that's asked a question, if that's okay. I am now going to hand over to Tom McCaskill-Baxter from the Department for Transport, because we are moving into our update on our Tackling Loneliness programme, and Tom is going to give us a national Tackling Loneliness update from the Department for Transport. So Tom, if I hand over to you, you should be able to share your screen if you need to.
Hi everybody, yeah, just let me share my screen. Good to see you all. 1 second, apologies. Yeah, sorry, I seem to have a couple of issues with sharing my screen. It's not giving me the option to do so. I don't know if someone from the CTA was able to put the presentation up, if possible. I'll keep trying though.
Sorry, I was on mute there. Yeah, if you start, Tom, we will get one of the team to share that. Tom, if you just start, we're having a problem downloading your presentation.
Okay, I think I might have figured it out. Sorry, it just dropped me off the meeting for a second. Sorry about that. Right. Here we go. Share.
Excellent.
Right, is that working? Apologies.
It is. That's brilliant. Thank you.
Okay.
Sorry, Tom, I muted you then by accident.
There we go. Can you hear me?
Yes, you've just changed your screen though. That's it.
Yeah. Right. Here we go. Yeah. Great to be here, everyone. I'm going to talk to you about our Tackling Loneliness with Transport Fund. So from a policy point of view, and the government since 2018 set up the Tackling Loneliness strategy through DCMS, and this is a project that the department bid for through the Treasury's Shared Outcomes Fund amount of money, and we awarded £5 million in May 2022 to pilot projects with the aim of trying to understand the ways in which transport can be used to alleviate loneliness. It's quite an unusual experimental project, and one that's been fascinating to lead, and could create some interesting sort of developments in the future. So as it says there, these projects are heading towards completion, and of the 12 delivery partners, as you'll know, CTA was the recipient of one of these grants. I'm just going to tell you a bit more about some of the other projects we did, and show you a few case studies from that area. And then I'm really looking forward to later in the day finding out about from Caroline and colleagues about how those projects have worked on the ground. So we set up a two-stage application process, and we didn't really know how many applications we were going to receive in terms of expressions of interest. We actually got 248, which was, fantastic. We're going back over a year now, but it's interesting to think about the desire for change in this area. And we did receive a huge sort of range of applications helping different types of people who are at risk of loneliness, because it can affect people young and old from different backgrounds, different places, and also different modes. And we wanted to make sure that we covered as many of those modes and different types of people as we could, because the aim of the project really is all about learning. It's not surprising perhaps that a higher proportion of the projects had a CT element, because of the important role that CT plays in helping people, and in some cases often people that are older or disabled. And sometimes those groups index higher for being at risk of loneliness. So from the 248, a lot of work went in, and we managed to get that down to 12 applicants who produced a full business case and were successful. And obviously CTA was one of those. We awarded funds to the following organisations, and a real range of kind of geographical locations as well as different types of projects. So just picking out a couple, we have obviously CTA and your onward grants to 18 community transport operators. We have the National Autistic Society, who produced training modules to help autistic people use transport and train transport operators in bus and rail. And another interesting example is Bikeworks in London, who have these quite unusual four-seater cycles which take people on rides, and there's kind of a real interactive element. So you may know this, and Caroline and colleagues will go into more detail later, but 18 operators received onward grants from the CTA, and that they're listed there. There's not enough time in the scope of this presentation to go into those projects in more detail, but we are fascinated by the scope of, like, the geographical scope of those, and also the different types of sort of target audiences as well. Well, something that's really important for us, if we're going to learn as much as possible, is that we want to try as many different things as possible. And it's been great working with the CTA in order to do that. We've had some successes in terms of recent communications. So one of our delivery partners, Age UK, had an article featured in the Telegraph, which brings in some research that they've done about the issues that are faced by older people relating to loneliness. And some of those have a sort of distinct transport link. There's stories about people who ride the bus in order that they can have some human contact. And Richard Holden, who you'll see later, visited one of our other delivery partners at Age Concern in Hampshire and took a ride on their electric minibus, which the elderly home used as a form of community transport vehicle. And that was really interesting. We've got some regional news coverage for that. One of our projects in Leeds also uses an electric vehicle, which they call a happy cab. And the Leeds Older People's Forum gave an onward grant to Bramley Elderly Action, which is in the east of Leeds, who purchased an electric taxi, which is used by its members as a bookable vehicle. And there's some of their members enjoying that service. Joyce, Bridget and Valerie, I believe. Community Rail Network focused on younger people and taking them out for day trips to try and understand about the role of rail, but also to help younger people, and these particularly younger people who are at risk of sort of loneliness and perhaps feeling anxiety, to feel more confident on public transport. And so some pictures of them enjoying those day trips. And TFWM in the West Midlands had a strong community transport focus in their project. They received just under £500,000 of funding from DfT. There were three elements to their piece of work. There was a door-to-door transport provision using community transport operators in the region that they gave onward grants to. They created community hubs, and these are still going on, in vacant commercial properties and bus stations and interchanges. And they operated 4 Let's Chat community buses, which visited local areas and acted as a kind of social hub. And it's been really successful. There's a few images following of the kind of delivery of the minibuses and how that's worked in reality. And also at Christmas time, of course, as well. So we've been thrilled with this project, and it's been a really interesting one to lead and to work on. Some next steps that we have. In June, middle of June, we'll work with colleagues at DCMS to celebrate is the wrong word, but to engage with Loneliness Awareness Week and to kind of build that and see what we can do from point of view of our projects. The evaluation report for the Tackling Loneliness with Transport Fund will be published before the end of the year, and we've had some interim findings through already. which has been fascinating, and certainly we're willing to share and kind of learn as much from that as possible, both within and outside of government. And coming to events like this, especially as the project starts to wind down, is really important to engage with stakeholders and get your thoughts as well on the project and the whole idea of tackling noise itself. So I'll stop the sort of formal presentation there. If there is time for questions, I've lost track of time, then I'm happy to take some. Otherwise, I'll be hanging around. Thank you.
Thanks, Tom. I am going to hand over to Sean, but Sean, I'm just going to share my screen, and we're going to kind of give a bit of an overview of our programme at CTA.
Good morning, everyone. So nice to see you all. As Caroline said there, I'm just going to run through a few of the slides here just to kind of touch on the project that kind of we helped develop and kind of work with our 18 pilots. Thanks, Caroline, for kind of prompting on the screen. Okay, so we're going to run through the aims of the project and then a quick summary of the results, and then hear from some of our pilots, and I'll kind of lead some of the questions for the pilots that I've kind of said they'd be part of this today as well. Thanks, Caroline. So just to kind of go over the project overview there, obviously we were looking at social isolation and loneliness in its entirety. We wanted to kind of pick up how the travel module of that kind of process worked and how it could interact with and kind of be an important part of that process. So obviously we were looking at towards kind of making sure that everyone knew that kind of travel and this mode of travel in particular, the community transport sector, is a lifeline for people who are isolated, and kind of how we could help maintain those kind of contacts, particularly in the space that we were working in. I think it's the last year or so we've had obviously post-pandemic, but we're obviously, as we started this, we were still in those kind of early stages of post-pandemic and trying to get people back into that community transport sector. So obviously we looked at a diverse group of groups. We had 18 pilots, which I'll touch on briefly in a second. But the main thrust of this was to kind of implement and deliver a different range of effective, different kind of pilots. We looked at kind of extending some of the work organisations were doing, delivering kind of new and innovative kind of ways to work, and also looking at how to bring in more volunteers. For us was to help build the evidence base so we could see what the impact was, and then obviously to how community transport helps disproportionately to affected people by loneliness, and to also share this work as well. So obviously the work itself that we've done over the last year, it's the start really of a way for us to kind of engage with and see how this work can then develop on and be used by our wider membership. Thanks, Caroline. We also kind of obviously used a number of questions in part of the survey process. That was obviously we looked at how to kind of reach out and actually get the response from the groups we're working with and the individuals, the beneficiaries, I think we call them. So we used a number of different questions here, and we used the UCLA questions that kind of looked out to effectively to measure loneliness, I think, really. So obviously the questions were around how often do you feel that you're lacking companionship, how often you feel left out, how often do you feel isolated from others, and obviously how often do you feel lonely. So we had those kind of at the beginning of the participants kind of events and activities, and then at a latter stage we followed up with the questions as well to ask how they felt from the kind of interacting with the pilots. Thanks, Caroline. We can move on to the latest one. Oh, Caroline got really excited there about jumping through. So I think obviously we've looked at the 18 pilots. I've said earlier to my colleagues, this was really difficult for me to just pick out one or two, because I feel like they're all incredibly precious. So what I would encourage you to do is, after the conference is over, we're going to send out some information about all of the work that we've done to kind of link into these pilots, look at their website, see the fantastic work they're doing, not just within the Tackling Loneliness project, but the work they do kind of et al. Really. So I've looked at a one or two, and I'll just kind of mention them in summary really. So AGK Trafford kind of collected socialized older people and took them out to various different venues, to garden centres, cafes, historical buildings, and it was also an opportunity for them to assess other support such as falls preventions and benefits activities. We had Majatu, who provided transport to families and individuals, especially those racially disadvantaged, living in hostels and hotels, including refugees and asylum seekers. And then we had a group called Otterley Action, who worked specifically with older men in the area who were socially isolated and were reluctant to engage with the wider community. And they wanted to address this by identifying and encouraging engagement and participation. And then we had SCA Transport Services, who kind of developed a transport buddy system, which is where they could get kind of a tailored service to help people regain their confidence about accessing kind of public transport and those modes of transport that we deliver. And then we also had South Central Community Transport, and they had a We'll Meet Again project, which is they were specifically looking at kind of working on the weekends with these individuals, because obviously a lot of groups work over the week, but it's that kind of what happens at the weekend to kind of how do we interact with people and how do we work with people. So as I said, that's just a brief summary of a number of the pilots that we work with. We will talk a little bit more in detail with some of the pilots as the day progresses, and we will talk a bit more about some of the work that they've done as well in the later workshop. Thanks, Caroline. I think if I hand over to you now for the wonderful array of stats that we have.
Yes, apologies there. My computer got a little bit excited with jumping forward. It knows I like messing with stats. So I'm going to kind of talk through some of the early results that we've got from our Tackling Loneliness programme. I know a number of the pilots are on the call and on the meeting today, and I just want to say a massive thank you, because it's not been an easy thing to share the data on this programme. As Sean mentioned, so there was 2 data returns that our the pilots were doing. One was a trip data return, which we've been sharing with the Department for Transport as part of the broader evaluation. And there was quite a lot of information that was required for that. And then the second was some survey data, kind of measuring the actual impact on loneliness on the individuals that were accessing the support. So overall, from our trip data, we've got the pilots in total supported 2,171 unique people as part of the programme. The pilots, so the majority of the pilots focused on delivering actual transport, and a number of pilots focused on individuals volunteering within community transport organisations. And we wanted to try and look at does volunteering in CT have an impact on people's loneliness as well? So a small number kind of had volunteered. All of our pilots covered one of the client groups who were most at risk of experiencing loneliness. So we have got a bit of data on some of those. In our fuller report, we'll give more detail on the trip data. We've just got to cleanse it a little bit. Our pilot sent us information in last week, and we just need to do a little bit of cleansing before we can share more of the data on terms of the number of trips, the number of miles, and the time spent on a number of bits, just so we're giving you accurate information. But just to kind of show a little bit, one of the things that I really like about this programme and the pilots is that while, yes, kind of nearly 50%, 48% were kind of an older client group, actually nearly half of our participants, our beneficiaries, were younger. So it really does show that CT is transport for all. It's not just about supporting people who are older, it is about supporting everybody. And that's one of the things we'll be able to kind of promote with this information. In terms of some of the other bits, so older, I've got the age bracket there, 23% of the people were from BMA backgrounds. So again, we've got a good kind of feel and a good cohort there. 29 people, so it's a smaller group, but one pilot particularly focused on veterans. So we do have a small cohort of results from veterans. And again, we've got a small cohort of people who are care home residents, and a small cohort who are carers. Of our young people kind of aged under 29, 10% of those were in rural areas. So again, we've got a good proportion of our young people who are kind of within a rural area. But I've got some interesting information on the kind of rural urban split in just a second. So that's the kind of some of the headline data. Unsurprisingly for many of you, most of the trips were undertaken kind of in minibuses, kind of with 9 to 16 passenger seats, but we did have a number of either cars or smaller vehicles or MPVs involved in the project. And the main trips that were undertaken were social activity or day trips. So while we have had in the pilot a number of trips that were to medical appointments, they were more secondary trips. So we weren't specifically funding pilots that were taking people as part of transport to health, but we do have a number of trips that were undertaken for health benefits or health and medical appointments. Sorry, my computer's being a bit sensitive today. So this is a little bit on the impact of community transport. So the middle of this just shows some of the quotes that we had from people. Now, we had just under 1,000, there was about 900 and something follow-up tackling loneliness surveys. So there was a lot of comments for me to read through. And it's kind of maybe a document that we do need to send out to all partners, because, you know, by the end of it, you're like, why are we not funding this way more than we kind of are? Because it really does make a significant impact. In our Tackling Loneliness survey, we had a baseline survey and a second follow-up survey. In the second follow-up survey, one of the questions we asked was, what has been the impact on your feelings of isolation, loneliness, and companionship? And so just as a simple measurement, you know, by far the majority of people had a positive, so 68% had a very positive impact, and 25% had a somewhat positive. Now, there are a couple of stats there. I've made them white so you can't see them very well, but 1% had a very negative, and 1% had a somewhat negative. So that was a bit interesting. They're low numbers, but when I went and had a look at the comments that were then attached to those scores, actually, I'm not quite sure if they were if they meant to tick kind of negative, because actually the comments that followed them were very positive, with someone saying they now feel safe and they can go out on their own. So yeah, while I don't think there's been a significant negative impact for anybody as part of it. On the right hand side, the kind of wider benefit and themes, these are the kind of impacts that people have been feeling from accessing the support. So creating new friendships and new relationships came out really strongly, that was an impact and a benefit that people had. Being able to create those friendships really impacted their levels of loneliness. Feeling part of a community was for both volunteers and passengers, actually, that they felt they were part of something else. So it's not just about their relationships with other people, it's just generally feeling part of things. And there were quite a few comments from people who were saying they actually didn't realize they were lonely. They didn't really realize they were lonely, or they said, there's no reason I should be lonely. I'm married, I've got carers coming in, I shouldn't feel lonely, but I do. So I think, you know, it strengthens some of those views around, you don't have to have no contact, it's the right kind of contact, and how do you feel about that? We had lots of comments about how actually CT was the only thing enabling them to leave the house, that without that transport, they would not be leaving the house. And, you know, with a lot of kind of conversations around kind of digital and reducing car journeys and kind of having your shopping delivered, actually a lot of people really want to get out, they really want to leave the house, and we need to give them that option to do that. Lots of kind of impact around creating independence and confidence when traveling. And a lot of that links to a bit further down where it says the trust in the driver and the service. And I think that's really where CT comes into its own, where there were lots and lots of comments about how because of the friendliness of the driver, because of how that driver engaged with them, actually that was the thing that they benefited most from in that journey. So some really nice bits there in terms of the importance of the service and the added value that community transport really brings. There were also lots of comments about carers and family members, so particularly family members who were living further away than kind of parents and things, and actually how it was making them feel better because they knew their family member was being supported. And for our volunteers, that kind of having a sense of purpose and fulfillment was a huge thing for a lot of the volunteers in terms of the comments that we had. So probably not much there that you don't already know, but this is the lovely thing about research like this, is that actually now we can say this isn't just anecdotal, this isn't just what you feel, this is kind of, we've got some real evidence and research for the sector. So as Sean mentioned, we used the UCLA 3 questions, and then we had a direct measure question. The 2 graphs that you've got there show the percentage of movement. So these aren't the percentage of people that have said these, this is the percentage of movement. So this is for the whole cohort, these 2 measures. So the UCLA, there were 3 questions. How often do you feel isolated from others? How often do you feel left out? And how often do you feel you lack companionship? So the yellow onto the UCLA questions, the yellow is the percentage change from people who said often from the baseline to the follow-up, the change from people who said some of the time, and the change from people who said hardly and ever. So what we're kind of seeing from that information is that generally across all 3 questions, less people feel lonely, or less people feel isolated, left out, or lack companionship often after the intervention, which is great. That's what we want to see. We want to see people feeling left less often. Generally, those people are just moving into some of the time. There's not a huge kind of movement into hardly ever or never. So that movement is kind of up 1 in the scale, but actually that's great. You know, for some of the pilots, somebody might have only had 2 or 3 journeys. So actually there's, you know, with quite a small level of intervention, we are seeing a proportion change. The direct measure question was an interesting one. So with the follow-up and with the baseline and the follow-up survey, we didn't require pilots to ask the same individual, primarily because there was a huge data requirement on pilots already. We were giving them quite small amounts of money. So with this question, they had 5 options they could choose from. So did they feel lonely often and always, up to never? And initially the graph starts off quite nicely. So we've got a 7% reduction in people who are feeling lonely often or always, and then an increase in the number of people who are kind of feeling the others. So that's the movement we want, until we get to never, where actually we've got less people feeling lonely never than we had before. So we kind of had a little bit of consideration about why that is, and obviously there's a little bit of a flex because it's not the same people necessarily filling in the baseline and the follow-up survey. If we actually merge a little bit the direct measure question, so it's got 3 options like the UCLA measures, we do actually see overall an improvement across all. So effectively, if we merged often and always and some of the time, then there is a 3% reduction, and if we merged hardly ever and never, there's a 3% increase. So there's that question is a little bit kind of skewed overall, but actually generally the flow from every other part of the analysis of the programme shows that people are generally moving kind of from often or always into the next scale, and then kind of within that people are moving just a little bit within it, just to give some extra kind of bits. So in terms of our target groups, the age, so young people were the second most likely to feel lonely often or always, which nationally young people aged 18 to 29 are the most likely. So in ours they were the second most likely, with the most likely being age 60 to 69. This kind of, and that general feel of all of our target groups, that result flowed that target group generally had a higher than average rating of feeling lonely often or always. So it followed with our people with long-term health conditions. They were more like, they had a higher rate, 23% of them compared to 15% across the whole group. Our people from ethnic minorities, again, they were a higher proportion. What I will say is anyone that was more likely, they seem to have had a bigger decrease in their feeling after the intervention. So actually, for those that were our target groups, we were having a slightly bigger impact on them than any individuals who were not part of our target group. So for example, gender wasn't particularly a target group, and our measures in that showed that generally male and female were experiencing the same levels roughly of loneliness. Men had a slightly bigger decrease than women, but it wasn't as big a decrease as we were seeing in some of our target groups. So that's just a bit of a summary. I was going to try and pull back time, but I've failed a little bit. So the next steps for this, obviously we've got today, we're going to hear from the pilots, and we've got our learning workshop. We're going to be putting our full report out in early to mid-June. And we are looking at doing using the ECT social value toolkit to do a social return on the project. So we will be able to do that within our main report as well. And then between July and September, we're going to be doing some individual project reports, and some additional sharing and learning from the project. So that's me, and we're now going to hand over to our pilots. So Sean, if you're okay to introduce the first pilot.
Absolutely. Thanks so much, Caroline. So yeah, as Caroline mentioned there, we're going to hear from two of the pilots that have been obviously part of this project. So we have today with us, just one second, if I can just remove that. I've covered my screen when I was trying to bring it. So we have Helen Flynn and Laura Crossley from the Nidderdale Plus Partnership. And we have Sarah Williams and Helen Allen from the Swan Advice Network. So if I can bring in the Helen and Laura from Nidderdale Plus. Helen, if you'd like to just give us a brief overview of the project itself and where you are and kind of the how the pilot made a difference to people in these locations. Oh, I'm sorry. So what services and activities have you provided, rather?
Yeah. So the timing of this was perfect for us because we'd literally just taken receipt of our minibus, which had been very delayed in arriving. We already run a community transport service with a community car and drivers using their own vehicles. So the idea of us getting the minibus in any case was to we're aware in our area that there's a lot of people who suffer from social isolation. We're a very, very highly rural area, sparsely populated, and that's why we'd got it. So the timing of this couldn't be more perfect. So the way we pitched the project for the CTA and the way we've carried it out is we wanted to combine the activities with befriending. So part of our application was around having a befriending through transport coordinator, which is Laura, who'll be speaking in a minute. So the idea was that she would organise trips, facilitate them and attend the trips in order to create the links between people who were on the trips so that there would be a benefit to the journey beyond the journey. And so that was the whole kind of point of it. So we wanted to have a general program of trips, which is what we have done over the period, but we also wanted to very specifically work with groups like lunch clubs, groups in villages, etc., in order to kind of deepen our kind of presence in Nidderdale and make sure that it was an activity that was open to everyone, not just people who were based around Pateley Bridge, which is where we live. So to date, we've had some success with that aspect of the deepening of the project, but we are going to continue with Laura in post, and we're going to find the money one way or the other to kind of continue that work of deepening. But the activities that we've been doing, which we've been putting on ourselves, which is 1 or 2 trips a month plus a weekly trip to a local market town, have been incredibly well subscribed. I mean, most of them have been oversubscribed, and we've had to, on some occasions, had to put on 2 buses. So it's it's been great, particularly as the period of time which I've complained about to Sean on a couple of occasions has not been ideal, because we haven't had a summer in this project really. Our first trip last year was kind of the end of August by the time it was all up and running. So we think this has been a great springboard to kind of continue our program, and the feedback we've been getting, which Laura can talk about in a minute, has been absolutely amazing. So thank you very much, CTA and Department of Transport.
Thanks so much for that, Helen. We really appreciate it. And yeah, if we can bring Laura into this as well. So Laura, just a general kind of question about how do you feel the pilot has made a difference to the people in the other locations you work, and what was the sense of the feedback that you've had from the people who participated?
We've had lovely feedback that all our day trips that have been attended, they've been attended really well. As Helen said, we've oversubscribed. Sometimes I've had put on separate buses because they've become really popular. The feedback we get, I've got some quotes written down from some of our regular travellers. That one lady hadn't left the house in 3 years, and she'd finally come out and had a lovely day out and made new friends and had the best time. Our regular market trip that we run, I've noticed a very small, maybe just 2, a little group of that, and it's got bigger. So every week somebody else comes, and these people are going off and they're doing their own thing. They're going to lunch groups together, and they're doing things outside of our service, which is like just great. As Helen said, we used lunch groups, knit and natter groups, WIs, we've done talks with them, and it's really got us out and found people that are in need of the service of, finding friends and things to do. And we've just, our first trip started at the end of August, as Helen said. We went on the canal in Skipton, and last week we went again. We went to see the bluebell, the bluebells that have all come out in the woods, and we had 5 hours on the boat while everyone sat and chatted and had cake and sandwiches and tea. It was lovely, really nice. I can't see how they're not just going to keep building and getting more and more popular.
Fabulous. Thanks so much, Laura. Also, just as a brief, Laura was doing a lot of the driving for this as well. So she's obviously been there, not just helping kind of set up and deliver, but also doing the driving for the project. So have you enjoyed that experience, Laura? Can I just ask you briefly before we move on?
Yeah, I know someone was saying before about the relationship between the driver and the people that come on. I think it's helped me in my post, because I'm not just sort of sat at the front and ticking everyone on the bus as they come. People are chatting and they get to know me, and I'm sort of part of the service. Like, they see me, and we go every week to Ripon Market. It's been not something I thought I wanted to do, but I've really loved it. Yeah, it's been great.
Thank you both. Thank you. That's really good. So if we can move on now to the Swan Advice Network, we have Sarah and we have Helen. Sarah, I think we were going to come to you first, just to give us an overview of the project itself and kind of what your project aim to do and why.
Yeah, we are a car scheme based down in sort of southwest England somewhere, if you want to imagine, somewhere between Bath and Wells, if you kind of imagine where we are, but we're in a bit of a deprived area where we're actually located. We set about with our project wanting to create volunteering opportunities for people at risk of isolation and loneliness, and we decided to take our focus as the young people group that you were hearing about a bit earlier when Caroline was saying how high the loneliness is that the 18 to 25 age group suffer. We knew it was going to be a challenge when we set out, and it has been. But I think it's been really, really worthwhile. I'd got some experience of working with young people. We've been running the community transport for about 20 years, and actually we just kind of felt that there was a lot that could be gained by joining some of the young people with some of the older people. So we set out with the aim, partly because during COVID, we'd had some students that had joined us as drivers. So that's kind of where some of the feed idea came from. That have been just great with some of our older people. So we wanted to use them as volunteers, either to become car drivers or to act as companions when our passengers needed support. We don't have our own minibus, but we use a minibus sometimes, or to host our cuppa and chat sessions. We had realised over the years we've got an awful lot of very isolated, lonely passengers, probably like you all have. And then we'd started running cuppa and chat sessions to bring some of those people who weren't meeting others together so they could spend time together. And so we thought perhaps we could involve some of our young people as volunteers in that group as well. So that's where we set out. Just like the previous people have said, it feels a bit like a short project. We had to take on a new member of staff to run this. So Helen didn't actually join us until September. So she's really had to hit the ground running and to find these people and to get going with this. So.
Thanks so much, Sarah. And obviously then moving on to Helen. So Helen, obviously we just heard there that you came into the project a little bit later, but also obviously if we could talk around the challenges that you faced recruiting those young volunteers into the CT sector, and how did you take this pilot in a slightly different direction from those challenges?
Hi, Sean and everyone.
Hi.
Can you see me? Am I there?
Yeah.
Yeah, hi everyone. So thanks, Sarah, for that intro. You did all the work on kind of like where you started out. So I think I'll try and keep it brief. I mean, I think obviously this is a difficult age group to engage with, particularly if they're lonely or isolated. If I go through very briefly what I think the main challenges were, and then I'd also just like to look at what we did to overcome them, how we changed. The main challenges, I think, was identifying how do you find and identify lonely and isolated young people. That in itself is a challenge. We quickly realised that we needed to sort of network, and we did this. We really worked hard on networking. I mean, for anyone that's looking, engaging younger people into their organisations, the things that worked were to meet with local youth groups, colleges, universities, Duke of Edinburgh, Prince's Trust, Scouts, local community police were helpful, social prescribing teams. I think just be creative about where you go to find isolated young people. If you can meet up with local established youth leaders, then that's a really good in. So that's what we did. The second challenge that we faced was kind of engagement, so building trust. What we found, I mean, I think we all understand the landscape here. As Caroline said earlier on, a lot of young people are incredibly lonely and isolated, probably more than ever, sadly. And we found that young people needed considerable support to build confidence to be able to volunteer. We put in a lot of support early on. So I tried to meet people face to face as soon as possible in an environment that they felt comfortable in. So that might be their favourite cafe. I've also done a home visit for somebody that's got mobility problems. So it's kind of meeting young people on their turf, if you like. That's what we have found has worked. And I think once that relationship is established, then we've seen young people really shine in their roles and their confidence increasing. Another tip that's been really useful for us might be useful for someone else. Young people seem to really like communicating on WhatsApp. So I've been using that. I've got a work mobile, and having that ability to just do regular check-ins, letting people know about events, that's worked really well. Also having visuals and images for young people, that seems to be really good. Showing them photos of other events, showing them photos of the venues we're going to. They're very used to having social media and having, you know, an image. So I think that's been a really good way of engaging people. So that's the second challenge. That was engagement. The third challenge was really around roles. So I think Sarah said, you know, we felt like in the beginning that young people could come into our organisation and kind of slot in. That hasn't really happened. A lot of young people are not driving. And also the impact of lockdowns has had significant impact on young people's social and developmental sort of skills. So we've really sort of shape-shifted and created roles to suit each individual. Some of them have been coming to our cuppa and chat and are doing brilliantly, hosting and interacting. Some have had background roles. They've been in the office, creating playlists for our events. So I think it's about being creative. So that was that. And I think about halfway through, we realised we weren't going to get the numbers that we'd hoped for. So alongside Community Transport Association, we decided to, alongside the engagement of volunteers, we decided to really focus on learning about how young people saw community transport and volunteering. So every opportunity that I had, I kind of took a bit of a dive into that. We also employed the university to do some research for us. So we've taken on a bit of a sort of research role. And I think some of the things that we've really found is that young people don't really know about community transport, or they see it as an older person's kind of world. And yet a lot of young people, for them, transport is a real barrier. A lot of young people can't get to apprenticeships, placements. So I think there's definitely something there for us all to think about in terms of how we make community transport accessible to young people, how we maybe make it feel a bit more youthful, and you know, how we kind of create that kind of diversity in our services. So that's kind of where we got to. I mean, there's been a huge amount of positives. I did say, Sean, didn't I, that I wanted to bring those in. It's not all doom and gloom. We've had some very, very strong intergenerational connections that have been formed. Our older people say that they love having young people around to chat to at our events, and equally the young people are really enjoying having older people. And I think there's been a huge increase in confidence in the younger people. A couple of quotes. So somebody said, "I've come out of my shell. I feel more confident. I feel like I belong." One of our overseas students says that Swan Transport is my UK family. So there's a lot of really good things. And from the previous pilot, it was really lovely to hear about the sort of sustainability of it. So a lot of our, some of our volunteers have gone on to become friends with other volunteers. So that's a lovely sort of connection that's happened. And one of our young volunteers has also taken on a sort of befriending role with our passengers, and they now meet monthly. So those kind of connections, I think we can't make them happen, but creating space where they might happen has been really, really fruitful.
Thank you so much to both of our pilots there, and thank you so much for all that. It's such a fantastic kind of space that we've been working in this last year, and I've really enjoyed the kind of the time that we've all had together to kind of watch these pilots build and grow. So if I hand over now to Caroline to move into our, oh gosh, we've got a little bit of feedback there. I hope that's okay. To move into our next section, which is a policy update on the BSOG kind of grant fund. Thanks so much, guys.
Just before we move in, I am going to, because I think Tom's still on the call. We haven't got a huge time for Q&A, and there's a few questions in there, but I thought I'd be remiss not to ask Tom Matt's question that's come in the question and answer box about regarding any future funding as a result of these pilots, and will the results lead to any change in funding policy towards CT?
Yeah, sure thing. So I did see those. So I was writing an answer, then it dropped out. So I'm back in now. So as long as you can hear me.
Yes, we can hear you.
Good. Yeah, that's fine. So yeah, I think that the short answer is that we need. This is kind of quite an exploratory project in itself. So we need to see the findings before we can kind of make decisions about for future funding. In terms of Mark's question about the financial sustainability of projects, we've been clear from the start that there was no further funding agreed for these transport-related learning interventions. However, that doesn't mean that the delivery partners that we've worked with haven't benefited in some way from the money they've received. For example, the experience that they've developed in the case of some of the delivery partners means that they can put themselves in a stronger position to make future further funding bids, sometimes not directly related to transport, but from other sort of funding pots within government. Other delivery partners purchase capital assets, and we're content those will be put to good use after pilot delivery ends as well. We're very happy with the project and how it's developed, but until we have that kind of final readout of the kind of the findings of the project and which perhaps areas to focus on in terms of what would be most fruitful, I think I can't really kind of commit to anything else, as you might not be surprised at this point. I'd also mention that we've had a really good ministerial engagement with this project from the start. It's an unusual project for us to take on. DFT usually kind of doesn't engage or doesn't work directly with or fund charities, particularly kind of charities that are outside of the transport region, but that's something that we've done here. So that has all been part of the learning experience for us as well. And my colleague Steve has just said he's also put a reply in the chat as well, so you got it in text too. But I hope that's helpful.
Yeah, thank you, Tom, for that. Thank you for a good answer there. Now we're just moving on to the next portion of the conference. A bit of a change from the tackling loneliness. Now we're going to look at the bus service operators grant, which I know for many of our providers is an essential form of funding. So we have Millie O'Driscoll here from DFT, who is the BSOG policy and reform lead. So I think she's got a presentation. So whenever you're ready, Millie, you want to deliver that?
Thanks, Josiah. Can you hear me okay? Excellent. Morning, everybody. Thank you very much for having me. I am Millie O'Driscoll. I work in the Department for Transport in our bus funding team, and I am leading on reforming the Bus Service Operators Grant, the BSOG. I will take you through what we're trying to achieve and why. I'll talk to you about some of the main proposals in the reform package, and I'll talk you through our timeline as well, and there'll be time for questions at the end. So I'm going to attempt to share my screen now. Hopefully that will go okay. You should be able to see this now, and I'll just put it on slideshow mode.
Yeah, we've got that.
Excellent. Oh, all going surprisingly smoothly. So I'll start out by saying what is the BSOG and why are we interested in it? So BSOG is the main funding that DFT pays into the bus sector to support buses, and really the aim of this is to get people where they need to go by bus, and the best way for us to do that is to support operators, especially kind of in the post-pandemic context where it's been really challenging for a lot of operators. We have this kind of reliable, steady stream of money going in. So the BSOG itself has existed since 2000, but it's been around in various forms since the 60s. The aims are really broad. It's about keeping service levels higher and fares lower than they would otherwise be. We last updated the BSOG in 2013. And we have been trying to update it ever since. Just getting a bit of feedback. If everyone could check they're on mute, that would be great. Thank you. So we committed in the National Bus Strategy a couple of years ago to consult on the details of a modernised BSOG. We said we'd do it in 2021. We got a bit distracted by the pandemic. We're very keen to make that consultation happen this year. We're really eager to get views from community transport operators in this consultation to make sure we're getting it right. We know the bus sector is really diverse. We've got everything from tiny little operators with one bus to huge big PLCs with thousands of buses in their fleet, and operating in lots of different contexts, from rural to urban and everything in between. So we know that it's a complex picture, and we're trying to make a reformed BSOG that can work for everybody. So yeah, very keen to get community transport views. And just to kind of add a bit of context, we have been providing £2 billion of emergency support in the last couple of years, including bus recovery grant, £2 fare cap grant, and we are looking to announce the next couple of years of funding and kind of what our support for the sector is going to look like very soon. So some of the priorities for the BSOG reform itself are around kind of resetting the relationship that government has with the sector, kind of to take into account the fact that things have changed, and essentially the pandemic has accelerated trends that we've been seeing for decades in terms of declining ridership and changes in travel patterns. So some of our top priorities for reforming the BSOG are making sure that the sector is on a more sustainable footing, broadly maintaining connectivity and service levels. So this doesn't mean preserving previous services, kind of, I guess, preserving them in aspect, you could say. We're not about trying to kind of cling on to old timetables if they don't necessarily work. It's about maintaining levels of connectivity and kind of understanding that some change is going to be needed there. And the final big priority is protecting rural. So
sorry, Emil, I think you're having some connection issues. Oh, I think we might have just lost her there. So hopefully she'll.
Oh, yeah, hello.
Hello again.
Let me share my screen again. Okay, there we go.
There we go.
Hopefully, yeah. Great. So yeah, as I say, this is not an exhaustive list. We are still finalising the proposal package. I should say that these are proposals, and we need to gather evidence on them. We want to gather data and views. So this is by no means what the final iteration of the reform package is going to look like, but this is the basis upon which we'll be kind of asking our questions and gathering evidence. So some of these were trailed in the National Bus Strategy, some of them are new. The main one, which you may have heard about already, is that the BSOG is paid on fuel usage currently. We would like to change that payment metric to make it kind of more relevant to our current policy aims. So we are likely to include options for a distance-based payment metric, which should be more beneficial to longer routes, especially in rural areas. And we're considering whether to include a hybrid metric as well, which might be a mixture of distance and passenger-based payments. We currently have a rate for zero-emission buses, which is separate to diesel buses, and we'd like to continue to have a separate zero-emission bus rate. We are proposing to remove the incentives that we currently pay for things like automatic vehicle location and the low carbon emission bus incentive, and some of those will be wrapped into minimum standards. So for example, automatic vehicle location is already a requirement under the BODS regulations. So instead of paying an incentive for that, we are proposing to introduce it as a minimum requirement for claiming BSOG. The allocation method for the local authority BSOG, so this is the pot of money that we give to local authorities every year. We have been giving them the same amount since 2013. It was based on kind of a snapshot of how many kilometres were being tendered back in 2013. We've not updated it since then. So we want to have a new kind of more responsive way of allocating that local authority funding. proposals for devolution of BSOG funding and policy to local authorities that want it. So giving local areas more control over how they spend their bus funding in a way that is kind of more appropriate for their local context. As I mentioned previously, some terms and conditions or minimum standards. So, suggested dates for example, when would we expect to see smart ticketing measures? A question about whether we should, for bigger buses, see a second flexible bus space in addition to the statutory requirement for one wheelchair space. A question about whether we should be able to pay BSOG for different types of flexible transport and kind of opening up the eligibility there, and some administrative changes. So, for example, we currently pay the BSOG based on estimates in advance of need. That's really unusual for a government grant. We'd normally pay in arrears, so just kind of aligning more with government policy on that. And reducing audit requirements for Section 22 operators to make them in line with Section 19 operator audit requirements. So there's lots that isn't on that list, but these are the headlines. And we're also considering the split of BSOG funding between commercial operators and also community operators and local authorities, and kind of how we move the dials there. The last slide I'll share before taking down the screen is just this timeline. So we are planning to launch the consultation this summer. We'll have it open probably for 10 weeks. We'll then analyse the results and agree test that with the UK's new subsidy control regime.
Sorry, Emil, I think you're just sort of losing a bit of connection there again. But I think that's fine. I think she mentioned that was the last slide. So I don't know if she's still around or potentially dropped off the call there. Oh, there you are, Millie.
That's fine. I was done sharing anyway. So just to kind of finish talking through the timeline, we're really keen to have a runway between announcing the reforms and implementing them. That's to give operators plenty of time to get ready, also to give our own operations team in DFT plenty of time to get ready, because we'll be obviously changing the way we make our payments. So to kind of close off here before I take questions, what we're up to at the moment is, as I said previously, agreeing those future bus funding arrangements, finalising the remaining BSOG proposals, drafting all this into a consultation, and then we'll be looking to clear this through ministers and get that consultation published as soon as we can. So I will pause there and take any questions.
Yeah, thank you very much, Billy. I think we've got time for maybe one or potentially two questions if we get through them quickly. And the most likely one is from Nigel Hinch, who's asking, will DFT consider the external audit requirement? Will the external audit requirement and sort of reviewing that? I think that's something you potentially mentioned within the PowerPoint itself.
Yes.
I think we might have lost you there again. I don't know if I don't know if the connections are going to allow a Q&A, but I don't know if she's still there now. I think we'll be best to move on from this. I think the connections aren't going to allow a Q&A there potentially. But I think what was mentioned within the PowerPoint, the consultation is a great place to ask all these questions that you've put in. So do keep an eye out for the consultation, which Millie mentioned will be coming. CTA will definitely let you know when that's there. But I would urge you to keep an eye on that yourself and do respond to that when it comes out, if it does affect you. And yeah, some of those questions in there, potentially some good things to raise within the consultations themselves. I think we're might be on to the next section now.
That's myself. Hi there.
Hi, David.
Just, I'm not able to share my screen at the moment, so I don't know if that's something I could just be given permission to, and I have a presentation too.
Oh, it should be there now for you, Damien. Can you see it there?
Yeah. It's that inevitable question. Can everyone see? Hopefully.
Yep.
Brilliant. Okay, brilliant. So pleasure to be with you. I'm Damien Greenhalgh. I'm a project manager in the National Voluntary Partnerships team at NHS England, and I work on the NHS Volunteer Responder Programme, predominantly lead on piloting and the new development of things with the programme. Just a bit of background, I've joined NHS England in March last year, and I've come from the voluntary sector, from an organisation where I managed volunteer car schemes, and once upon a time we did have a community bus, so I know the value of the organisations, what you bring, as well as the challenges that you go through. So idea today, I just want to have a really canter through what the programme is, how it came about, where we are now, and what we're hoping for the future, and just update you on a bit of the piloting work, which includes colleagues on the call as well. So just on. So the programme basically was set up in response to COVID-19 and the pandemic. So many of you will remember there was the government and the NHS asked for volunteers to come forward to support with that extraordinary pressure. Over 750,000 people came forward to help. About 450,000 people were registered and supported in some way, the programme. And obviously, and the main purpose at that time was to support those people who were having to stay at home. Royal Voluntary Service and Good Sam were our two partners to help us deliver that. That was delivered through a smart app provided by Good Sam, which provided tasks and matched individuals that could help with those tasks. And that was across all of England. Some on the list there, you'll see some of the types of things, which included phone calls, prescriptions, food delivery, and obviously transport of individuals, which is relevant to today. That was expanded to support with the mass vaccination programme. Many of you will have probably received your COVID vaccination from these centres and seen volunteers at sites helping. The vast majority of those have been supported through the programme. As you'll see, that over 2 million individual tasks, or as we're referred to, but shifts on average of 4 hours. So 200,000 people involved in that vaccination programme. So by the end of March last year, we sort of got to the point where it was assessed that the COVID response period for the programme was probably at an end. So things were paused to take stock. The vaccination and the NHS transport role, which was predominantly more logistical, helping with equipment and things, and prescriptions, was continued whilst that stock take was undertaken. And subsequently, some of the roles that were paused have been brought back. So where we are now is that following a public procurement exercise, RVS and Good Sam were recommissioned to provide the programme, and obviously to meet the current health and care needs, but with renewed focus on local needs, system and place level needs, and how we can get the best from this national infrastructure to local places. We commissioned a partner to help us with some of that design and development and piloting. They're called the Innovation Unit, and I'll mention a bit more about them in the next slide. And we've continued to work with the National Vaccination Team, and it's now expanded to flu as well as COVID, but that's programme still going on. And one of the latest updates is we're in the final stages of the Department of Health and Social Care looking to come as a joint commissioner of the programme to expand into social care, which I know will be relevant for many people attending. So in that restock, in that retake, these were the strategic aims that were come to about creating that resilient pool of volunteers. Ultimately, there's a national programme. It's about having a national pool or regionally that can respond to emergencies such as the pandemic. We obviously don't want anything like that again, but it's always planning But also having that does mean that we can relieve pressure on local services as well, and that's a particular town, geography, a district, etc. And we can provide real-time capacity. So that's both in responding to needs as we see it, particular pressure, but also the actual technology. What we call ping allows for people to be asked for in a matter of hours, as well as that more traditional, could you do something tomorrow in a couple of days sort of shift arrangement. And a real key part was around inclusivity and flexibility. So that was both in about participation and widening and making sure absolutely every person that was able to give out and receive is able to use the service as far as possible, but also in terms of the technology reaching to places that maybe we've not been able to reach before as the NHS, as a sector, or as BCS organisations. So really, in summary, it's a national footprint. We want it to be used, absolutely utilised for the benefit of local areas, changing, having a real impact for people and valued by volunteers. So currently there are these roles live, many of hopefully familiar to some, with some in the process of just about to be relaunched or renewed, including the hospital discharge and sort of virtual wards to help stop, get people home quicker. And you'll see in terms of some of the program specific piloting with ambulance, it's about when we do have those pressures at hospitals and ambulance crews stacked outside, can people be supporting them because they often can't leave the patients until they're discharged into the care of the hospital. So wellbeing, so trying to look at every part of our health and social care system and see where we can support and to bring in that support. And telecare is a fairly new one in that it will be entering into homes as well. So during the COVID pandemic, most of the activity was done in the community or up to the front door. So looking at ways that can maybe change. So I mentioned that we'd got a support from the innovation unit who work alongside a team at Nesta. So really what they've come forward with is a methodology that you may have heard of and maybe have been involved with before, but it's called the 100 Days Challenge. Ostensibly, it's around grabbing people together to look at nitty issues or things that need to be done differently, and sort of permissioning people to think differently, step outside of maybe the ordinary ways of development, things that maybe take a long time or labyrinth, and look at those questions and ultimately within a 100-day period get to some small scale testing. And we're currently on day 43, and I've said, like Caroline, Mark, other colleagues are involved in that as well. And it really is about co-design. And I know people might have a view of NHS, and I've certainly worked in the sector with the NHS, but I would say that our team truly does believe in these principles and actually being led by what people want and wanting to make sure that the benefit of this national spend and national things is boosted to local voluntary sector organisations. So the 3 pilot areas are listed there. A common theme is that transport has emerged. We didn't go with expectations or any particular outline of how it was to be used, but in Sussex and Greater Manchester, transport is the focus, and there is still an element of that in Gloucestershire. But as you can see there, Gloucestershire is probably, I would say, more tilted towards health and social care partners, but with voluntary sector involved, and they have a local programme that they're looking to work on. Sussex is very much voluntary sector with Sussex Community Transport, other small scale groups that include car scheme services, and Greater Manchester, which is in partnership with Caroline and the team. And we've got obviously Mark from HMR Circle and Stockport Car Scheme involved in piloting that with a view to that providing some national learning. As we're sharing these slides, I've just included these contacts, which is RVS's regional relationship managers. They're there to answer any questions if you potentially want to be a referrer, if you want to understand more. So I've just included those. But to summarise, I would say that I've come from the sector and maybe worried about what the purpose of this was and what the benefit could be, particularly to those grassroots organisations, and see it maybe as a rival. I would really want to disabuse you of that and say that there's an investment in infrastructure and there's a model, and we want to make sure that that can be used. And that's working again with Caroline and Mark and others. We're really trying to explore the best ways we can do that and make sure that it has maximum impact, benefit to your types of organisations, as well as obviously the NHS and its outcomes, and not wanting to do anything that would jeopardise that as well. So I believe Mark's coming on after, and there'll be questions after that. So thank you very much. It was to time. I did say it was a canter through.
Thanks, Damien. Yeah, we've got Mark up next. So Mark is a CTA provider who's running a community car scheme, who's going to share some of his insight with us.
If you can just allow me to, it's looking like it's working.
We can hear you. Yep, and your screen sharing.
Yeah. So as Caroline just said, I'm Mark Wynne. I'm the director of Haywood, Middleton and Rochdale Circle. We operate a volunteer drive service in Rochdale. I'm going to start with a little quiz just to make sure everybody's awake. Just 3 quick questions. If you can put the answers to question 2 and 3 in the chat, or just write it on a bit of paper, we will work on trust. And it just possibly does seem a little bit irrelevant to the topic, but it works its way around in the end. So where would you go for a coffee or a meal with your friends? That's question 1. In question 2, in what year did the Sex Pistols play the Lesser Free Trade Hall in Manchester? That was the big breakthrough concert for punk rock. And in what year did the Beatles last play the Cavern Club? So 3 quick questions. The first one's a subjective answer, so you can't get that wrong. And the reason we always start with that question is if you were going out for a meal or a coffee with your friends, very rarely would anybody say, I'm going to go to a community centre, or I'm going to go to a church hall with a leaky roof. But that was the offer available to all the people. We do lunch clubs, we do use church halls, but we wanted to build something a bit broader and a bit wider to support more older people. So the context of today's conversation is around linking with health, and we do 5 things that build that programme. So we do social, practical, befriending, digital and transport. We'll come on to transport as we go along. But our social offer is we organise 60 to 70 different social events every month. They range from meeting up for a coffee, going out for a meal, walks, talks, quizzes, all the things you traditionally associate with older people, through to indoor skydiving, hot air ballooning and abseiling down Rochdale Town Hall Clock. So we do things that people like to do, but we also do the things they've always wanted to do. So this is a big part of the offer, and it does link back to the transport, because we need to provide a diverse offer to engage with more people. We also have a practical service, so that does small practical jobs. So we help with gardening, decorating, DIY, moving boxes, changing light bulbs, all the jobs older people struggle to get somebody out to come and do. We have a team that does that. But obviously, we're honing in on the volunteer driver service. So the volunteers drive as a service, and you're all CT providers. Volunteers use their own cars. We do about 1,000 trips a month, predominantly to hospitals, medical-based appointments, but also social events, which we spoke about before. We will come back to the volunteer driver service. But does all that nice stuff work? Does that organising the social events, putting on the transport to get there, or to the doctors, does it actually make a difference to older people's lives in particular? So we've done a lot of work around the methodologies, and just shy of 80% report increased social activity, over half improved self-confidence, over half improved well-being. 14.4% reduction in GP visits. Extrapolate that across the country, and that's a massive build. New friends, and 6.94 average new friends. I'm not sure where the 0.6 is missing, but it's in there somewhere. It's in there somewhere. And like I said, it all comes back to, we always hone in on this again. Does it work? I think it was Disraeli, lies, damn lies and statistics. You can make and prove anything, but we were approached by an organisation studying social isolation in older people, and they said we were the best example they could find worldwide. So that was quite a pat on the back for us. and they asked could they come to an event to see the social group and the transport working together, and we said absolutely. And that group flew in from Osaka in Japan. It was the University of Osaka. They came to Rochdale. That's not on any EasyJet or Ryanair flight. And they just had a great time. But what they said, they felt they weren't coming to something clinical. They were coming to something as just a group of friends out on a social event. So we, you know, that, and I think that's all we've ever tried to achieve with all the things that we do. But it comes back to the home from hospital. How does that bit dovetail into the wider offer? And we were approached by the local authority to say, had we any innovation or new ideas on how to get people home from hospital, but also to reduce the times they were going back into hospital. And it's been great working with Damien and Caroline on the Good Sam app, and all that dovetails into it. But when you've got a resource like a volunteer driver service, and and everybody on this call, your drivers to a man and woman are fantastic, and then they're the best advocates, and we use that skill set, that pool of engaged people to sort of help reduce readmission into hospital. So the driver will go and pick somebody up, take them home, make them a brew perhaps, have a chat, keep in contact. But we are then able to offer the wider circle offer. We're able to offer the social activities. We're able to offer the practical support and the digital support. And we're able to offer the volunteer driver service aspect to keep people out. And that's been a bit of a success. The only downside has been the lack of engagement sometimes with hospitals. We work in 4 hospitals, and a couple of them are a bit reluctant. And I don't know if Damien's experienced this coming into the NHS. There's a reluctance to change. But we keep knocking on the doors, we keep badgering, we take boxes of chocolates with leaflets on, just to get them to try and engage in that wider offer. And I think when it's being delivered by volunteers who are absolutely, super engaged, really, people don't feel it's clinical. They feel they're being picked up by a friend, and they have that contact is a human contact. It's not people doing a service. And we have to be honest, you are restricted on the number of trips that you can undertake, but ambulances take some people home because they need ambulance service. In Rochdale, there's called Home in a Day, which is a supported transport. So people who are in wheelchairs or you need extra support to get home. But then the people who fall below that support, I would always use myself as an example. If I was in hospital, heaven forbid, and I was ready to come home, I'm fortunate my wife or my eldest daughter would come and pick me up, but people aren't in that position. So we've created a service that helps get people home from hospital. It does exactly what it says on the tin, but it dovetails back to keep them from not going back. We're able to offer that wider social offer. So it was good hearing about some of the work around the social isolation stuff earlier, and how that can also dovetail into the Good Sam app. So it's probably a nice little segue into lunchtime that this is the end of what that process can potentially look like. So I'm just going to finish off on a little bit above a boast, but I will give the answers to the quiz questions. For whatever reason, our model has been picked up in South Korea. We've had about 6 or 7 different delegations from South Korea. We're on the syllabus in universities for South Korea. We were due to fly out to South Korea, but a thing called the pandemic hit, which is a slight frustration. So we did an online conference to South Korea. And what we say is we're taking our northern soul to Seoul. But it's all good at how it all dovetails in. And all them component parts, a CT on its own does great work. But if you can dovetail it into that social offer, to a practical support, to a digital support, to befriending, it becomes a fully rounded thing that can link then into the health service. So I've gone through all the hospital bit, and the one you've all been waiting for is the answers to the questions, and I will look in the chat and see who's cheated or not. So the Sex Pistols, the concert was in 1976, and as it says on the slide, the average age of a person who attends a concert is 27. The person who attended the Sex Pistols concert is now in their 70s. The social offer that they want isn't Vera Lynn and Gracie Fields. So you've got to build your social offer and your entire offer around that. People aren't that generation. The you know, older people are getting younger, not physically but metaphorically. And the Beatles was in 1963. So the 27-year-old who attended the Beatles concert is well into their 80s. So that, in a nutshell, and gives us plenty of time for lunch and some Q&A, is me.
Thank you so much, Mark. Thank you, Damien, as well. And now, yes, if you have any questions, you can just drop them on the chat or on the Q&A box, and we will be reading to them. And yeah, I guess Mark and Damien are going to answer those. I know that we had a question about the details of the contacts. I hope you got those ones, Steve. If you don't, can you please drop a chat to Damien so he can share those to you as well?
So I think the slide can be shared. I've shared it with
yes,
CTA colleagues. That's happy to be. So that's probably the easiest way for that. And obviously, my email's on the front of the cover, so if anyone wants to pick stuff up offline, or.
Of course, thank you. Yeah, I'm just gonna reply to that one.
I don't think there was questions, but some of the comments I saw in the chat was just to I would agree with Mark and others' comments around sometimes the reluctance of NHS trusts, because I understand that's primarily who you're working with. We as NHS England can have some influence over that, particularly in the pilots. We're looking to join things up as well, and we'll use everything within our power to do that. But I would say the team I'm in, NHS England, we have the responsibility to champion volunteering in the NHS, and near enough all of my colleagues are from the voluntary sector. It's absolutely what we're about and what we are, and we bang the drum for the voluntary sector and making sure that it's properly respected, properly funded as far as possible. So I think there was a comment around, you know, this programme is obviously a national programme, but that's where national policy is set, that's what the government and the NHS leadership would like to have it, but we are trying to make sure that investment nationally is absolutely to the benefit more locally. I think the future is very much on a local level. You've seen the direction of change with NHS, that got IC integrated care systems, bringing together more formally the VCSE, health and social care. So I think that is where more decisions were going to be made, and we want to help with everything we do to make sure that you guys in the voluntary sector have an equal place at the table and are respected, and your skills and attributes are used, basically. So that is, say, from the absolute bottom of my heart, with my head and my heart, that is exactly what our team are working towards doing, and that's what we're seeking to do with this programme.
Thank you, Damien. Yeah, do we have any more questions for our panel? Oh, yeah, there's something else here. How can CT operators be part of the Volunteer Responders Program, and also who's funding the project?
So the programme is nationally funded. The pilots are currently funded by NHS England, but with developing a more local approach, we are looking to show that benefit to integrated care systems, the ICBs, the integrated care boards that make those financial decisions, to show the improvement or the impact it can have. So one example, just in discharge, some particular hospitals, we found one hospital spending £160,000 on using private taxis to send people home from discharge. If we could use our programme or yourselves, there's a saving to that trust. And that's the sort of thing where, as well as it being better for the individual, having that friendly, you know, face that Mark's referred to, and that I remember from my time managing those services, that actually there's a financial saving to trust, and they need to invest in you guys, they need to invest in this type of offer, which in the sense of this programme, it would be around covering travel expenses and the like. But in terms of the infrastructure, the safeguarding, the other support that's there, that will be funded nationally and for use locally as well.
Thank you, Damien. I think these are all our questions so far. I know there are a few comments on the chat box. but we can continue that one over there. I'm just going to hand over to Caroline before we go to break. Thank you so much, Damien and Mark, for this.
Thanks, everyone. I really hope you can't hear. My husband has decided he's going to mow the grass. He always seems to do this whenever I'm part of big meetings. So I hope if you can hear a lawnmower in the background, my apologies. We've had a really fantastic morning, loads of really different and interesting conversations and topics that we've talked about. We're so pleased we've not run over for lunch. So for those of you that hopefully all of you will join us again for the afternoon session. We do have a couple of asks as we move into the lunch break. One is if you are staying, so after our lunch break, so at 12:30, we will come back and we will be joined by Richard Holden MP, so the Minister for Roads and Local Transport. And obviously, please make sure you've got some questions, nice questions lined up for him. This is a great opportunity. When you go for lunch, please can you stay logged on to the call, just turn your camera off and mute yourself, because what we will be busy doing while you're having a little bit of a break is moving you into the breakout room so that when we come back, we can make sure you're all in the right places. The other request that we've had is for you to make sure your name, if you are able to change your name, so in the bottom, I'm kind of pointing in the bottom corner of mine, it says Caroline Whitney. You can, if you can change that just so it's your name, your full name, so we can make sure we're moving the right people into the right workshops when you come back. We do have a networking space, so if anyone wants to grab a bit of food, come back and talk to others, we will have a breakout session, so anyone is welcome to join that. Just make sure you turn your camera on, flag, and one of the team will move you into the breakout room. And I'm just checking my notes if there's anything else to tell you. I don't think it is. So when you come back, we'll have the Minister and we will have the workshop sessions. But I urge you all to go and have a nice comfort break, get a little bit of food, come back, and we'll have a really interesting conversations and discussions this afternoon. So thank you.
Claire, what time are we, Caroline, sorry, what time are we back this afternoon?
I'm terrible, aren't I? I've not told. So we will be doing a 12:30 start. So if you can make sure you are kind of turned back on for 12:30, we'll have a short intro and the Minister is joining us sharp at 12:35. I'm shortly going to introduce our chair, Alan Jones. And hopefully the Minister will be joining us online if he hasn't already. But I'll hand over to Alan to do his initial welcome.
Thank you, Caroline. First things first, I thought you chaired the morning session very, very ably and on time. Well done, it's a difficult thing to do. It's a privilege, obviously, to be the chair of this organisation, particularly at this moment in time where we have moved through many changes, but we now have a fantastic management team. I'm sure you'll all agree. And Caroline, I know you've put a lot of effort into today, so thank you very much. It's my honour to be here and to introduce the afternoon session. I was really taken by the speakers this morning as well, the passion and their commitment, particularly in the loneliness project and the amount of take-up that's had. And it shows how we need to look at all of those things. Statistically, I was surprised how many young people were involved in that loneliness. Perhaps I shouldn't be, but I was. And our last speaker talking about what music people like to hear. And those people in my sort of age group, yes, we want the Beatles, we want all of those things because that's what we enjoy. So it was very well said, and I think all the comments this morning were great. So thank you for all your participation. We're making lots of changes and have made lots of changes in CTA. And there's no doubt about it, we are stronger together as an organisation, and to welcome great best practice from all of you guys and your organisation so that we can share that. We've not got all the answers, and you're at the coalface and you see this every day. But we're committed to move forward and to make this a business that's second to none, and we're on the right track. So it's my pleasure now to introduce Richard Holden, MP. He's the Roads and Local Transport Minister. I'm delighted he's able to join us, and I'm sure we'll have a number of questions for him. So, Richard, if you're around, I can't quite see you yet. Welcome.
See me and hear me.
Ah, there you are. I can see you and hear you. Thanks very much, Richard.
No. Well, thank you very much indeed for having us. It's great to be here today, and thank you, Alan. And I'm delighted to join all of you today to recognise the vital role that community transport plays in enabling particularly accessibility and the most inclusive travel as well. Community transport is integral to our transport system, providing that really pivotal link that connects people, services with education and employment as well. In many areas of the country, including parts of my own constituency, it is the only form of transport available to people. And it also particularly enables the most vulnerable and people who might not otherwise be able to travel to do so as well. You'll have heard earlier today about particular challenges faced by our society around loneliness particularly, and how community transport is helping tackle this growing issue. And I was delighted to visit a project alongside community transport as part of it down near Southampton a few months ago. The government's Tackling Loneliness strategy was launched in 2018, and since that point we have launched a range of projects aimed to reduce loneliness in society, particularly following the COVID pandemic and with the COVID-19 Loneliness Fund, and also through our Tackling Loneliness with Transport Fund as well. Through the innovative grant scheme, we've now invested, I think it's over £5 million in the 12 projects that allow us to better understand and evidence how transport can address the issue of loneliness. And as part of this, in May last year, we were delighted to award the Community Transport Association just under £500,000 to deliver 18 pilot schemes with local partners right across England as well. These pilots are enabling community transport operators to extend their reach and target people at risk of loneliness by expanding existing services and also creating new volunteering opportunities as well, which I'm particularly pleased by. And we look forward to learning and sharing more about the outcome of these projects later this year when the evaluation of the pilots programme concludes. And we'll be publishing all of that and using all of that to inform next steps in this space too. More broadly, I know that this entire period has been incredibly challenging for bus services generally, but also for community transport operators in particular following the pandemic. I do want to acknowledge, as my predecessors in this role have done, the huge contribution that the community transport sector has made during the pandemic to support local communities and particularly vulnerable people as well. And I am hugely appreciative of the work that you do and recognise the difficulties that you face as well as a sector. I know that post-pandemic, just like in the bus sector, many voluntary drivers have not returned to community transport sector, and recruiting new drivers has been challenging. And last year, my department launched a call for evidence looking into driving licensing, including around D1 minibus driver licenses. My officials continue to look at the results of that, and we want to do everything possible to make it easier to recruit volunteer drivers to help support your important work. But we also need to ensure that passengers, including those who are vulnerable, are safe, and we are exploring this issue step by step at the moment. Knowing the crucial role that community transport plays in our cities, towns, villages, and in our spread out rural communities as well, especially for vulnerable and isolated people, we want to do whatever we can to maximise use of community transport services. That's why we've encouraged local transport authorities to engage with the community transport sector, particularly when developing their enhanced partnership plans and their bus service improvement plans. And I'm hoping that that work will continue and develop as those plans become more established and over time more funding and other elements made available for them as well. And it's why the government provides around £3 million a year through as well through the community transport sector via the BSOG funding to support vital services too. As you heard earlier today, we are committed to reforming BSOG. We welcome the views of the community transport operators on the proposals to modernise and future-proof BSOG, which we will be consulting on again later this year and into next year. So please keep an eye out for that. And I know from my own community operators how important that's going to be as well. And as we move forwards, we will continue to work as closely as we possibly can with the Community Transport Association as it seeks to deliver support, development, and to clearly represent the sector as well. And my department will continue to reach out to the sector to ensure that we fully understand the challenges that you face, and we'll do everything we can to support you, enable you to continue to provide the vital services that you do provide on a local level. And finally, I just want to thank you all, the whole community transport sector, for everything that you do to support and connect people, particularly the most vulnerable, and ensure that our transport system is as accessible and inclusive as possible for everyone in the country. So thank you very much.
Thanks very much, Richard. That's very good. Obviously, you've mentioned funding. We're constantly looking for that, as you'll appreciate, and any help you can give us with that would be fantastic. Caroline, will you organise the questions for Richard? I'm sure there will be some.
I was expecting to be flooded, Minister, but oh no, they're all kind of starting to come in now into the chat box. So I know a question that someone did previously email me before. So Nigel Hinge from Ability was around whether you could confirm if there was any funding available, or whether there was a possibility for us to review and look at funding options for CT moving forward. Yeah, so I think we've allocated quite a lot through the this £5 million so far through the Tackling Loneliness with Transport Fund. I think the next big stages in the opportunities are going to be around enhanced partnerships, working with local councils through the BSIP plans. There may be more in that space in the not too distant future, so keep an eye out for that. And particularly, I'd say also, a lot of the local authorities who have had BSIP funding are going to be looking for different ways to deliver those services. We have maintained flexibility with dealing with the department in them. And I know there have been some real community transport successes as well. I was speaking to some of the guys from South Yorkshire recently about how they've managed to see some of those successes. So please keep looking at those BSIP funding, particularly on that super local level, and what you can do to help particularly the mayors or the transport authorities in certain areas and what they can do to deliver on them. In terms of broader funding, the BSOG reform, I think, is going to be particularly interesting for community transport providers. The historic funding around that model has been one way. I think we're now going to look at it, and the steers I've had from across the department is that we're looking at it in terms of a combination of distance and passenger. So actually, that might actually really suit the sector in a way that wasn't as suitable in the past. So I think it's going to move away from purely that fuel subsidy based model to something which perhaps looks more. It will be potentially more advantageous to community transport. So just be very aware of that. And that's one of our biggest continuous funding streams. It's not something you need to keep bidding into on an annual basis. And I think when I speak to most of the sectors, what they want is that sort of long-term security of knowing that what things are going to look like. So I think that's going to be a really important moment in terms of funding, and particularly that longer-term funding, so you know where your revenue is going to come from. And I know this is something a lot of you have been calling for as well for quite a long period of time.
Minister, I'm really sorry, so we're going to have to.
One more question.
One more really quick question.
Sorry. I've got a very back-to-back day today, but one or two very quick questions, and then I'll I'll be very quick.
So there is one question on here around, is there more help that government could give to CT around things like the ULEZ expansion or clean air zones, in terms of, because I know that's a blocker that from a CTA perspective, we've been finding, trying to kind of have better exemption or better inclusion of CT in those considerations.
Let me address that one directly. I've got to be very careful about how I deal with individual authorities and what they're planning to do in this space. What I would say is, if you are doing stuff, try and engage in the first instance with the local authority itself or the local transport authority. If you really are getting stuck with that, do raise it with whoever your local MPs are or political MPs across issues about exemptions for community transport and stuff. Just go to them, raise those issues, and that's the, you may need to apply some pressure more broadly in some of these spaces, and so try and have those conversations initially. If you're not getting anywhere, then turn them, you have that your elected representatives will be interested in what you've got to say, so use them, and get a few of them to do debates in Parliament and that sort of thing, so you keep the issue raised as well. I'm always happy to speak about them, but the truth is the decisions on these areas are made at usually combined authority or sometimes at local authority level, and so it's difficult to back devolution and then not allow them to do these things. It's about getting those decisions right at local level in the first place, and then sometimes getting some of these schemes tweaked a bit to understand actually the community transport sector, because I know this is something that has been bubbling away. Go on, one very quick final question before
the final one, which again you might not be able to answer this probably because it's more kind of the Treasury, but I suppose it was to flag. So we've been pushing the increase in the AMAP to the 45p mileage rate, because actually we're saying that is a blocker to recruiting volunteers. So I suppose it's what support can DfT give to our conversations with the Treasury around that.
Yeah, no, you are one of a number of groups getting in touch about that. But what I would say on that is that if you feel you can justify it, that it is guidance, right? And this is what I do tell to my local businesses as well. This is guidance around 45p. You can go above it if you can prove beyond it, basically. And I'm sure that in community transport sector, that shouldn't be too, I know it's extra bureaucracy and you want it to be simple. I 100% understand that. I think it's something, it's something we will continue to raise to the Treasury. On the specific examples of community transport, though, I think it would be worth you as an organisation going to the Chancellor directly and raising the specifics, because of the unique nature of you guys. Because, for example, there are authorities within the system as well. For example, some of the health authorities do different mileage rates for different people at different, they don't follow the standard operating model. And I think some form of work, a small exemption for community transport, I'm not saying it's likely or possible, but I think there's an argument to be made there, which is stronger than in some other spaces as well, given the nature of the vehicles, etc., that you guys have to use.
Super.
Well,
we have tried that, but we'll try again.
Right, keep trying. And I would also say, look, there'll be some APPGs in this sector. I don't know if there's an APPG for community transport. I'm sure there'll be MPs interested in doing it. And given it's a discrete ask, I think it's one of those things where there would be there's a natural space for looking into this sort of thing. I can't promise anything. There's obviously, taxes are Treasury matter, and sometimes they can be it can feel very bureaucratic when you're trying to deal with some of these elements. But look, it's an argument that I hear loud and clear, and will continue to make on your behalf. Right, I really do need to go because otherwise I'm
no, brilliant. Thank you very much for your time.
Alan,
we appreciate
thank you very much, Caroline, and thank you for your questions as well. And please do keep in touch, and don't hesitate to write to me as well about any of these issues too. You can even write to me about the stuff about 45p a mile, and I can then forward it onto the Treasury saying, actually, this is a Treasury matter, you need to respond to these people.
Yeah, we will certainly do that, Richard, and we are part of an APBG now, so we will take it through there as well. Thank you very much for your time.
No, thank you, Alan.
Thank you.
Just on that
So-
point, Caroline, just on the APP group, we now belong to one. I got us into one 2 or 3 months ago, so we can now lobby them in the House of Lords as well as the Commons. So.
Super. Thank you. I know there was a few questions that weren't asked kind of around EV and the kind of future around electric. So we will kind of flag some of those questions, I think, with the Minister's office and see what else we can get back in the future. He quite nicely has left us right on time. So we are going to be moving into our workshop sessions for the rest of this afternoon.